Hello and welcome to another podcast from Hotel Technology. Today we're joined by Jonathan Gifford, Manager of Medical Education and Healthcare Publications, as well as Catherine Richards Golini, Editor of Healthcare Publications at Karger Publishers. Hello, team.
Hi there, good morning. Thanks so much for having me on today.
It's a pleasure, Jonathan. It's nice to see you again. Jonathan, I was wondering if you wouldn't mind telling the audience a bit about your professional background, please.
Yes, absolutely. So I'm currently the Healthcare Publications and Medical Educations Manager at Karger. But before then, I've been working in publishing for just over a decade, mainly in academic and medical publishing. And it's really something which I thoroughly enjoy. I really do believe that it's a job which can have excellent benefits for our audience, for our healthcare professionals and our patients too. So I've been with Karger now for about 6 years and thoroughly enjoying it. Love my team, love working with Catherine, and yeah, love to talk about these kind of topics which we're approaching today. So once again, thanks ever so much for having me on.
It's a great pleasure, Jonathan. And Catherine, if you wouldn't mind telling me a bit about your professional background.
Yes, hello, good morning. Thank you for inviting me to talk about something I love talking about. I am a healthcare publications editor with Karger. I have most of my responsibility seems to lie with patient materials, which suits me fine because that's what I want to do. I produce booklets and information sheets for patients. And prior to joining Karger, I joined Karger a couple of years ago. Prior to joining Karger, I spent far too long being a teacher of medical English. I live in Switzerland, and prior to that, I'd lived in London and Paris and Italy. And so, yes, I was very fortunate to be able to leave teaching and move into publishing, it seemed like a natural progression.
Thank you, Catherine. So I'll start with the first question with Jonathan, I think. And Jonathan, what are the key challenges facing medical professionals with regards to treating and diagnosing rare disease?
Sure. First of all, I think it's a great question. It's quite a broad question. For me, I think the main challenges that HCPs face when dealing with rare disease patients is surrounding awareness and knowledge. We could attribute this to a lack of research on the disease. So, a lack of data makes it challenging to develop evidence-based practices and treatment guidelines. It also means the patient could be misdiagnosed or diagnosed much later than they should be. We also have to remember that in some areas of the world, there can be a real lack of support systems. And what I mean by that is access to patient advocacy groups or even trouble accessing the right drugs to treat their condition. Think about, orphan drugs to treat rare diseases, which can often be very expensive and not widely available to patients. And these are really challenges that we try and address when we're producing our patient and healthcare professional education.
Thank you. I was coming from that answer. I suppose communication is a vital aspect of any relationship. I mean, the way we communicate defines our relationship. How can healthcare professionals improve their communication with patients who have diseases to ensure better understanding and trust from a patient?
Yeah, well, first off, through education and awareness, they're called rare diseases for a reason. And although healthcare professionals might not encounter patients with these diseases often, they really must educate themselves about rare diseases to improve their understanding, their knowledge, and ultimately patient outcomes. Another aspect would be through the use of plain language and visual aids. So ideally healthcare professionals should avoid medical jargon. When they're speaking to patients, they should use plain language to explain these complex medical concepts and ideas to their patients, and they should provide patients with educational materials from reputable sources, such as ourselves, with an emphasis on visual aids, diagrams or models to help illustrate that medical information. I really think that this will enhance a patient's understanding, especially when dealing with complex or rare conditions, to help them better grasp that information and actively get the patient to participate in their own care. And finally, I really could go on, but finally, I think, engaging with rare disease organizations is key. Healthcare professionals really must engage with these rare disease organizations and patient support groups. These groups often have really valuable resources and can provide additional support and information to patients.
Okay, so are there specific resources or training programs available to healthcare professionals to better understand or manage rare diseases?
Yes, definitely. So, in our increasingly, connected and digital world, that there are more and more resources online now for healthcare professionals and patients alike. Of course, as I mentioned, I think it's important to make sure that these are coming from the right reputable sources. But to give an example, healthcare professionals, they can access accredited e-learning courses which raise awareness of a particular rare disease. But we're often seeing that doctors are so busy nowadays, they might not quite have the time to sit down and do a half-hour course, an hour-long course, etc. So there are plenty of short-form pieces of content, such as podcasts, KOL videos, which can provide real key insights into understanding, the disease from diagnosis, from management, treatment options, etc. And from the patient side of things, infographics, summary sheets, interactive videos, animations, those kind of things. They're all freely available online, through our website, but also via patient advocacy group websites too. And these really help patients gain a better understanding of their condition. They get the most out of their visits to the physician, and be aware of, potential lifestyle changes, for example.
So what role do patient advocacy groups play in supporting patient education and health professional education, and how are you involved in that?
Sure. So patient groups, absolutely, they play a vital role, a pivotal role in creating a supportive ecosystem for individuals with rare diseases. That their efforts extend beyond patient support to include things like education, research, policy advocacy, and collaboration with healthcare professionals, which contributes to improved outcomes and quality of life for those affected by rare diseases.
If you can give me an example of successful outcomes between Karger and patient advocacy groups, that would be fantastic. Thank you.
Sure. Yeah, and first of all, I've got to say, in fact, we are so proud as a publisher to have collaborated with these patient advocacy groups across the globe to produce really valuable and engaging content. One example that springs to mind for me was working on patient materials for a condition called Waldenstrom macroglobulinemia. We'll call it WM for short, which is a rare blood cancer. So we partnered with two patient organizations, the IWMF in the States, in the US, and WMUK in Great Britain. So we worked very closely with both groups to put together a suite of really easy to understand and engaging materials. And I think here it's important to mention that a multi-format approach is key when educating patients, as we all have different learning styles and preferences. So, to that end, we produced a WM disease state awareness booklet. We produced infographics, a series of podcasts, as well as videos with real life patients and doctors speaking on them. And
I wasn't aware of that. Thank you.
Yeah, absolutely. Well, go and check it out. It's all available for free online for those interested. And it was really great because it was a fantastic mix of short form, bite-sized content alongside the longer form content for those patients wishing to take a deeper dive. And yeah, I mean, as I mentioned, all of these are available free online via the patient advocacy groups themselves. They actually made some real great efforts to promote it to their network via newsletters, in-person live events, and awareness days. So this was a really fantastic initiative, and it was great to see how closely we could work with these groups to produce this material from the very, very beginning, to have their input, and then to see how impactful it was once it was published.
So this is one of the ways that how patients have contributed to their own care in rare diseases, and how you've collaborated.
Yeah, absolutely. So, I mean, the point of patients contributing to their own care and education is key. You know, I mean, take for example self-advocacy. Patients often become advocates for themselves, so you know they're actively participating in discussions about their care, the treatment options available, and their overall well-being. You know, it's often said that rare disease patients are experts by experience. You know, they're sharing these personal experiences, this first-hand knowledge can be invaluable to other patients and healthcare professionals alike. You know, they can often offer insights that may not be readily available elsewhere. You know, and rare disease patients are more likely, I think, to seek out information on the disease themselves. So, you know, they might be researching medical literature, they may be attending conferences, using these online resources, such as the ones that we produce, to better understand their condition. And I think that it's also worth mentioning from a treatment adherence point of view, that patients who actively participate in their own care are far more likely to adhere to prescribed treatment plans. And in turn, they can become advocates for improved access to treatments, you know, raising awareness on the disease, participating in lobbying efforts, maybe, you know, such as sharing these stories to influence policy changes. So overall, I mean, patients who take a proactive approach to their care and education not only improve their individual outcomes, but also contribute to the broader understanding and management of rare diseases as a whole.
Thanks, Jonathan. That's great. Thank you very much. So, Catherine, welcome. I probably want to start with a question to you about what is the difference between patient-centric and patient-focused?
Okay, well, you'd think they were synonymous, and in fact, I'm absolutely sure that they are, although there have been attempts to distinguish between them. I wouldn't have bothered. I think it's simply a question of collocation, you know, word partnerships. But I think a much more pertinent question is, when we say we're doing something patient-centered or patient-centric, are we all, you know, are we talking about the same thing? Because this is a multi-stakeholder discussion. Jonathan has already referred to the different stakeholders involved in this, but we've got the patients, central, of course, their families and their supporters. And by supporters, I'm referring to patient advocacy groups and patient advocates, patient associations, but also the healthcare professionals, primary, tertiary care, specialist care, academic researchers. We mustn't forget them. I mean, it was academic researchers who came up with these terms in the first place 30 years ago. I mean, sometimes people think these terms have just suddenly appeared, and it's only because pharma have suddenly taken notice of them. Yeah, drug companies, they're a very, very important stakeholder here. Conference organizers, patients are increasingly wanting to attend conferences and symposiums. Last but definitely not least, healthcare information producers such as Karger, people who produce resources for patients. And, you know, part of the problem with a term when it becomes desirable and it's being used by multi-stakeholders and appearing in everybody's LinkedIn feeds is that there's a greater chance of these terms being used by people who've never fully questioned what they mean. It's all hashtag patient-centered. But what are we actually talking about? Patients actually don't really like the term putting the patient in the center because they don't want to be put anywhere. You know, they want to get there sort of on their own devices, by their own devices. And it starts to become a bit of a buzzword, and perhaps there's a danger of it all becoming a bit of a box ticking exercise. Are you patient-centered? Yes. But how many of us actually check in on our processes and procedures to make sure that what we're really doing is patient-centered. Are we fully engaging with the patient community? Are we listening to patients? Are we responding to what they say? And, as far as healthcare information production is concerned, that means we have to involve the patients at the very beginning of the process, in the middle of the process, and at the end of the process. And it wasn't long ago, actually, that information, and it still is in some places, healthcare information is still produced with no involvement from the patient community whatsoever. So I hope that's answered your question. Yes,
It has. And what would you say the elements of patient-centeredness are for both the clinician and for the patient?
Yeah, well, again, you'd think that we'd have an easy answer to this. And I don't think there's any one definition of centeredness, which is why it's problematic to claim that we're all being patient-centered. But there have been attempts to come up with definitions. I read a very nice paper just recently by a group of Australian researchers, actually. It was published in the BMJ Open in 2022, Sturgis et al. I think it's free to access. And it was a scoping review of the literature, how the terms patient-centered were being used in healthcare. So this is specific to one stakeholder group, healthcare. And it was quite interesting. There were very few mentions in papers related to primary care, suggesting that your local doctor isn't much bothered about it, but an awful lot in nursing, which I think is interesting. And there were 3 frequently described elements of centeredness in healthcare. And the first was shared responsibility, and Jonathan has already spoken about that. Shared responsibility. The second was the therapeutic relationship, and that contains elements such as empathy and trust. Again, I think Jonathan referred to trust, didn't he, when he was speaking? And the third is the patient as a person. So not the patient as their disease, but the patient as a person, and all that entails. And it was quite interesting. The researchers, the paper I mentioned, they also wanted to know what was the justification for centeredness. And they found that the central justification in these papers that they were looking at was improved health outcomes. And the most frequently described values that where researchers bothered to even mention values, and many didn't bother, was respect for the patient. Now, how much of that I can apply to information production is a good question, because I couldn't actually find any research that had looked at papers talking about healthcare information, patient-centeredness. So maybe that's something I need to do myself. What I will say, and it's personal, it may not reflect the broader healthcare information production community, but I think when we produce information at Karger, uppermost in my mind and primary is the right of a person to have information. We often talk about patient education as if somehow, I don't know, patients are lacking and we need to be educated. Well, we need to be informed. Whether or not we decide to read the information is our choice, right? But I think that there is a fundamental right to be informed. So that colours how we produce our information. Uppermost in our minds as well is the patient as a person. They're not their disease. And a person has, if I speak to 4 people about the same disease, they will all 4 have different experiences of that disease. And those different experiences may be clinically relevant. They may have vastly different experiences of how the disease manifested or their symptoms or how it was diagnosed. But their experience is also how they emotionally and mentally responded to the diagnosis and what their needs were. And we often forget this. When we talk about patient education, it's often clinical with a couple of pages about, oh yes, this could be tough. And what patients tell us when we speak to them at the beginning of our production process is how important all the other information was to them. And where to go and get help and where to go and speak to other patients. So we also try to recognize that patients are members of wider communities. They might be their families or friends or local communities or spiritual communities or cultural groups. And we try to acknowledge this as in our writing for patients. We do that with the way we write, the tone, certain references that we may make, illustrations, to be diverse as well.
I think what you've actually done with your publishing company is and one of the reasons I wanted to talk to you guys was that in medicine, in medicine and in nursing, I think that we often forget in very basic statistics, when you start to learn basic statistics, you learn the difference between correlation and causality. And I think that your publishing and working with patient-centered groups and the work you're doing is reminding people who are involved in the evaluation of treatment about the difference between causality and correlation. So I think that that's one of the things you've really started to achieve through the work you're both doing, or the team you're involved in. And I think that what will happen because of the work you were doing and some others are doing, a lot of the health technology assessment organizations will perhaps reassess the way they look at the patient and outcomes. Sorry, Catherine.
No, I absolutely bang on, Stephen. And it's quite interesting, actually, when you look at how patient-centered is used in pharma-published articles. Patient-reported outcomes doesn't loom large.
No.
Yeah. And it's quite interesting talking to patients and finding out what they want from their engagement with healthcare professionals and what they want with their engagement. And not everybody wants to go to conferences, not everybody wants to take part in a clinical trial, but we owe it to, we're all patients at some point, or we've cared for people who are patients, yeah? That we patients know where to go to get that information. It's sharing power. You know, we talk about empowerment a lot, but that's another buzz term. Some people, I don't really know what that means, but when you feel that you can ask questions and you can understand the answers, you are taking back a little bit of the power. And I think we can idealize the healthcare professional interaction. They're not all wise to shared decision making. They're not all wise to the wise patient, the expert patient coming in. Some feel quite threatened by it. But I think when patients can show themselves to be engaged, informed, they're asking the right questions, this can help healthcare professionals, I think, feel a bit more comfortable dealing with patients who want to know more.
So how can your publishing agency, how can an organization like you, who are information producers and information providers, overcome the barriers to patients involved in clinical trials and with medicine?
I think I would probably prefer to relate that to how can we overcome the barriers of engaging with patients to produce information. Because I think the first barrier, and it's actually common to all of the stakeholder groups, is reaching hard to reach patients. I mean, that's one of the principal barriers. You know, it costs money to go and travel to a trial center, and perhaps, you know, reimbursement isn't quite as generous as we think it could be. You know, sometimes I hear that patients are taking part in focus groups with academic researchers or information producers such as ourselves, and they're not being reimbursed for their time, or they're being reimbursed, but it's laughingly small. And so that doesn't seem to be respectful. That doesn't seem to be fair or respectful. And perhaps if patients felt that they were being treated, they can always choose to donate the fee. In fact, that's what we do at Karger. We offer different ways of being compensated, and many patients choose to donate their fee.
Okay, that's perfect. All right, thank you very much for that, Catherine. I think what you've both been achieving is quite remarkable, and I'm delighted to have been talking to both of you. If I made contact with you from a patient group, how can you help me?
We would want to direct you to where you could find our resources. And I think Johnny would agree that we would certainly direct you to places like Amazon, where you can download onto a Kindle for free. Our own website, you can download our materials for free from our own website. Many of the patient advocacy groups that we're working with will have, they don't all, but many of them will also have our materials on their websites. Johnny, would you add anything to that?
Sure, and I also think that, you know, we don't cover every rare disease under the sun, right? We've covered lots of them, but I think it's also really important for us to, you know, to listen to, you know, perhaps underserved rare disease communities that feel that maybe they don't really have the kind of resources that they'd like to see. You know, listen closely to them, And then really what we would do is look for some industry partners. By that I mean pharma companies, etc., who are maybe working in this space, currently researching drugs to treat such a disease. Then we would approach them to say, hey, look, there's clearly an unmet educational need here. We're in touch with, X patient group who said, look, we love your materials that you've produced on, WM, on CLL, on, various different rare diseases, but we don't have anything right now. We'd love for you to bring that forward. And then that industry partner, that pharma company, often they're really, really willing to help fund these kind of initiatives. Obviously, they're completely hands off. They're not telling us what to write. They're not telling us who should author it. We actually go back to the patient group then and say, well, we'd love to have you involved. It's what Catherine said a minute ago. We love to have the patient groups or representatives from those patient groups, real life patients, to be involved in the content development from start to the middle to the finish. So make sure that this is really relevant, to that audience. We're not telling them, what to do. We're actually consulting with them. What do you need, and how can we communicate this really effectively for other patients who suffer from that condition?
Well, thank you very much, both of you. I've really enjoyed the conversation. I wanted to say that what you're doing is, again, I think it's wonderful. And I don't know of many other publishing houses or information producers like yourselves who are doing this. So I think it's a bit of a game changer, to be honest with you. And that's one of the reasons that we wanted to talk to you. So I hope we can do this again in 6 or 7 months and talk about some of the changes that you've made. So thank you very much for your time today.
Thank you very much, Stephen. Thank you.
Thanks for having us. It's been really fun. It's been a pleasure to chat with you.